work with HLA quite a bit, so what you should do, I think, is sign up with them, and if you haven't already, and do their patient-centered health ethics and law training, where we go into a lot of detail and we have a really, really interesting time. So I think I've been listening to the other presentations, and I feel like they capture most of, what I think that healthcare professionals should do that will help them avoid legal liability. I think the topic I was actually given was, are patients adequately protected by the legal system in Nigeria? That was the topic I was given, and so as the room was emptying and as the thing was progressing, I said to myself, oh my goodness, what am I going to say to them? Because typically, once we say that, and most people, is everybody here a medical person? Do we have people that are not medical people? Anybody that's a lawyer? Okay, we have one lawyer in the room. Or that's anything outside of the health field. What are you, where are you from? What's your background? Administration, and yours is? Aviation. Oh, that's interesting. Okay. All right, so I had imagined everybody was a medical person. And typically, well, what I was going to say was that typically, as people are getting tired, they start saying to me, don't healthcare professionals also have rights? Is it only patients that have rights, and so on and so forth? So as the day was winding down, I was saying to myself, well, we're getting to that point. But what I have found, just from listening to all of this, is that in general, if you do into the medical research, right to quality care, and much of what we've talked about here, whether we're using electronic health recording systems, patient safety systems, all of that have to do with quality care. The right to complain and express dissatisfaction. This is contained in the National Health Act, where you're supposed to have a complaints system in place. And of course, that's all part of patient safety. You need to receive feedback so that you can step it up, you can improve quality of care. So all of this, typically, the law also allows people to sue on any of these grounds. And many of these grounds will provide room to argue that there has been medical negligence and that one deserves some kind of compensation. As we go on, I think that it's important, like I said, to go through these in your facility, to have it front and center, to share it with your patients in the sense that we're not being defensive. We're going to go out of our way to do what we know to be right. And when you do what is right, because some people will sue you regardless, right? You can rely on that. You can, in fact, medical negligence is a tough area to deal with. However, having said that, imagine if you're sued. If you're sued, you need to get a lawyer. You need to pay the lawyer, regardless of whether or not you're eventually found not responsible. So the best thing to do, like I said, is to understand that the law attempts, it's not foolproof, but it does attempt to provide certain legal protections to patients in Nigeria. I would argue that it doesn't go as far as it needs to go, but to the extent that we are able, we should do what? We should find a informed consent form, having already done a procedure, and this is a procedure they now need to provide information about. So there's I think about it now that I am on this side, and I realize that I would probably never have made a good doctor, but if you are a good nurse or whatever, because of the standard of care that is required, that the law requires of you. But having chosen this profession, I'm sure that you will do much better than I would in ensuring that your patients are protected. Thank you very much. If you have any questions, please do me a